I am Sylvie Barak, a somatic sex educator, sexological body worker, and stream practitioner with a background in neuroscience.
And I'm Angela Musio, a sexological bodyworker, stream practitioner, yoga teacher, and a mother. I help reconnect women with their pelvises to restore wholeness and pleasure. Together, Sylvie and I guide meaningful conversations, not only about science, body wisdom, and personal growth, but also about sexuality, eros, biochemistry, biomechanics, emotions, scar tissue, and the energetics of shame.
Join us as we discover the layers of the human experience and explore what it means to heal and thrive. Enjoy this next episode.
You know that pull, that spark inside. Your body speaks, don't let it hide. It's time to listen, time to feel, time to tap into the nerve to heal.
I'm really excited today because this is my first podcast with you, Angie, with my colleague from Stream. And we have been colleagues for a while. This is our first podcast together. And this podcast, by the way, is called The Nerve to Heal, as in, how dare you have the nerve to heal? Or the vagus nerve. Or what's the nerve?
The audacity, right?
The audacity, the nerve to heal. So in this podcast, we are going to be talking about lots of things that we both geek out on, especially the nervous system and sexuality and the intersection of those things. And we might go in some castor oil and coffee enemas and GAPS diet stuff.
That is the core of a lot of transition and a lot of healing, for sure.
Yep. So in today's episode, we're going to be talking about something that a lot of clients come to me with, and I'm sure they come to you with it as well, which is numbness. So if we look at the definition of numbness, it can be a lack of sensation, but also numbness can be a sensation. It can be a sensation of sort of dullness, of mutedness. It's hard to say nothingness because there is something there. It just doesn't feel the way we might expect or hope it to. I, for example, have a big scar on my abdomen where I had to have a hernia repair and abdominoplasty. And I don't have no sensation in that area, but I have very, very muted sensation in the area. And it feels very strange. So I can feel pressure and I can feel temperature, but it doesn't have the quality of touch the way that other areas of my body have. So that's how I would define numbness. But there's also emotional numbness. There's all kinds of numbnesses, really. There's genital numbness. There's, the kind of numbness where you burn your finger and then it's sort of numb but painful. So the painful numbness, non-painful numbness, annoying, frustrating numbness. Any other kinds of numbness?
Yeah, I think like the psychological tuning out, it's avoidance, right? So if there's a part of our body that we are not connecting with that is numb, I usually find that's a lot of avoidance. And it's a pain that holds a lot of emotional charge. And it is just easier to go around that. I also have hernia repair in my umbilical belly button area. And a lot of scar tissue is there. But for me, I know that holds a lot of emotional disconnection. Scar tissue contributes to it as well. It definitely does. It has a block there. But there's also just an avoidance of going to the belly. And I think for me, women hold a lot of shame and judgment for themselves in their bellies, particularly because we are looking at how we look, how do we appear, what are we supposed to look like, how do I feel about myself in the way that my belly looks, really.
And we all grew up with suck it in.
It's very true. I sucked my belly in all my teenage years. It was like just pulling the belly in. And as we know of the body, If you're constantly holding your pelvic floor in like that, you're not getting the breath. It becomes hypertonic and it can't get that freedom of movement.
Right. And it's not getting all that oxygenated blood. It's not getting the blood flow that's supposed to get. So the muscle, it needs to move.
Yeah.
They need to move. They need to flow. They need to be able to expand and contract. And yeah, you're right. We're not getting any of that when we're just holding it in the whole time. And we do see a lot of pelvic floor failure and a lot of what I guess people call dysfunction from people having sucked in their stomach for years and years and years.
Absolutely. And then, my mind goes into pregnancy when we are trying to deliver a baby.
Right.
And subconsciously, for example, when I was delivering, did not want to poop on the table.
Right. As if it's like the worst thing that could possibly happen to you. Never mind that the women's mortality rate for childbirth in the US is like astronomical. No, the worst thing that can happen to you is that you would embarrass yourself by pooping on the table. Never mind you might die. Okay, cool.
No, it is. And there's a whole thing around poop, right? But I remember pushing and holding in and trying to push at the same time. And that just doesn't make any sense. And like, that's also that block of connecting to my genitals, my anus, the whole body. And where is that synthesizing? How can my genitals with the numbness or the avoidance of being aware of contracting and not allowing what's naturally happening and trying to stop that from happening. So where is the coherence of whole body intelligence and allowing all of that to be connected? So I think a lot of people tend to just be with the genital hole, right?
Yeah.
So we are aware we have genitals.
Let's talk about what the genital hole is, because I know that as sexological body workers, we know that what that term is. And other people who might be listening to this might be like, yes, my genitals have holes in them. Yeah. What are you talking about? But the genital hole that we refer to has to do with that numbness that we were just talking about as well. Mm-hmm. And it is that feeling that many people can't access their genitals in their mind. So if I say to you right now, listening to this podcast, close your eyes and in your mind, locate your little finger on your right hand. You can probably do that. And you can probably even feel your little finger with your mind. You could also do that with your right earlobe. You could probably also do it with the tip of your nose. You can do it with pretty much any area of your body. But when we're saying genital hole, there are a huge set of people that if they have to locate their genitals in their mind and actually notice any sensation there, they can't do it. It's just sort of this blank space. It's very difficult for them to connect. It's like a cell phone or a Wi-Fi signal that just can't connect. Yeah. And that's what we are discussing when we're saying a genital hole. We're not actually talking about the holes in the genitals.
Yeah. Good to clarify that.
A lot of people come in with that. And they don't necessarily know. They don't come in and say, oh, I've just got this numbness around my genitals. They'll tend to come in and say things like, I just don't have a lot of sensation. I have sensation, but it's not pleasant. Or I'm just very disconnected from sex or from pleasure. And in that case, a lot of people are just not interested in it. Their libido drops. Even masturbation just tends to become not that interesting, because if an area doesn't feel interesting, why would you want to touch it? Why would you want to enjoy it? Mm-hmm. I mean, personally, myself, I don't spend a lot of time touching my stomach because I can't really feel it. And that feels weird. It feels weird to touch an area that doesn't really feel something. Mm-hmm. How does yours feel? Your scar?
Mine is very, I would say sensation-wise, it is very much like a wall. Mm-hmm. So if I poke around it and notice the tissues, I can feel a lot more diversity of what's happening as I move further into the tissues in my abdomen. But when I come to around the belly button area, it's definitely like a wall. And it almost is like it just ends there. Mm-hmm. So I often associate with it as a hardness because of the scar tissue. So that in itself creates the association too of I'm hard, right? Or I'm not
Right.
supple enough. So what I will tend to do is just stay with that. Oh, it's hard. Okay, well, what are the edges like? And start to be curious and gently move around this area and see what kind of sensation I can get from it.
Interesting for me to find the edges of the numbness. I did spend a lot of time doing that when I would get frustrated at the actual numbness. I would take my fingers and sort of spread them out and see how far it would go until I did actually start feeling sensation. And what's interesting is that border zone between the numb sensation and the sensation is almost unbearable feeling. That zone of, it's a border zone, really. It's a border zone between
Gray
numbness
zone.
and
Yeah.
sensation. And I think I'm more uncomfortable in the gray zone than I am even in the numbness, because it is that whole, that's beginning to be weird and uncomfortable. And then you
Yeah.
get sensation, it's like, okay.
Something we're more familiar with, and we don't have to deal with that uncomfortable,
Yeah.
whether it's scar tissue or how far we're willing to actually stay with that uncomfortableness. There's a
Yeah.
threshold to that too, right? Because there's an emotional charge there in some capacity.
Yeah. I remember having one sexological bodywork session once where the person was trying to bring sensation from areas that had a lot of sensation. So from my breasts and from my genitals, and was trying to bring it down from my breasts and up from my genitals over that area that had less sensation.
Right.
And at first, it would be so frustrating to be feeling pleasure and then nothingness and then pleasure again, that I started to cry. I remember that moment, starting to cry and feeling really bereft almost at the fact that I would probably never have sensation in that area again. At least in my head, that was the story, that was the narrative that I told myself, that I wouldn't have sensation there ever again. And I remember crying, thinking, people who I love will touch me in this area and I won't be able to feel it. I won't be able to feel the pleasure of being touched by someone you love in a place that feels good. I remember crying over that. And then towards the end of the session, being able to actually feel more, because first of all, there was an emotional release of being in the sadness. And second of all, there was the whole connecting of areas of sensation to areas that have less sensation. And you can actually build neurologically, you can build sensation in areas that have less. And that was such a cool realization in that moment. It really stuck with me. That was pretty early on in my sexological bodywork journey. And now it's something that I tell my clients all the time. You can build sensation. So even if you say you don't feel much, do you want to? Because if you want to, you can. You can build sensation.
Absolutely. And thank you for sharing that. I think that's deeply personal and really beautiful, that uncomfortableness and staying in it. What happens when you allow that to be seen and expanded upon? And I think another way to look at numbness is like almost a freeze state in that emotional component. Let's say if there's no scarring, because scarring definitely plays a role in that numbness. And it carries the emotional charge too. But if we were to look at a place that is numb, let's say like the G crest area, let's say that this has no sensation, and maybe this is supposed to feel pleasurable, but really it just feels like nothing. It just feels like maybe some kind of a rubbing, and there's more things you can explore. But what I want to point out is like expanding outward and then gently working inward and just moving slowly, because typically the numbness is holding that charge of something that was traumatic. So it is in a space of kind of a freeze. And if we can move slowly with it and gently encourage more sensational awareness surrounding the area, what evolves from that, like you're saying, is neurologically more neuroplasticity, more awareness in that way.
Right. So it's interesting. I mean, you mentioned the G crest, and for people who, again, are not sexological body workers or who are not well versed in sexuality or sexual anatomy, the G crest, sometimes called the G spot, which makes it sound like it's one little area, and if you miss it, then you'll never find it's a whole area. There's a whole area of engorgeable tissue. We call it the G crest because there's an area of it. And what's interesting about it is that you have to be pretty engorged. There's engorgeable tissue behind it. You have to be pretty engorged for it to feel good. And if you are stimulating it without being engorged, it's out of context for that area. And so it doesn't feel like much. It's sort of like I'll tell clients all the time, do you ever put brownies in an oven that isn't preheated?
Yeah.
Like what would happen to those? They wouldn't rise. They'd burn on the top before they rise. It's just nothing good will happen if you put something in before it's preheated.
Yeah.
And it's the same kind of thing, even if you're masturbating. It's not to be rushed because different sensation comes with engorgement. And when I talk about context mattering, something might feel really good to you in one context and might feel really annoying to you in another context. So if I am unloading the dishwasher at home and my partner comes in and decides that since I'm bent over and unloading the dishwasher, he's going to grab my ass, that is going to feel really annoying. It's going to feel annoying, irritating, not pleasurable, and he might get an elbow in the stomach or in the balls, depending on where my elbow reaches. So, whereas if I was aroused and I was in the mood and he grabbed my ass, that might feel really, really good. Again, sensation changes based on the context and how much time we've given it and whether we're upregulated or whether we're downregulated, right? And that has a lot to do with numbness too.
Yes, definitely.
Do you have experience with that context issue?
Absolutely. I would say I was always a person of being in a freezy response. And so if speaking about being in a sexual context with a partner, it was always in my younger years very easy for me just to tune out and just go with the flow. So sex was never really pleasurable because, well, I didn't know about arousal. I didn't know about engorgement. I didn't know that it varied in time for each person, how long it should take.
It can take between 20 to 40 minutes.
That's really important to mention because the engorgeable time, you have to be in a state of able to fluctuate and get some arousal, which is an upregulation, and also downregulate so you feel safe, right? But I was always in that state of freeze and kind of like masked and just letting it happen to me and not even realizing that I had a lot of say. So sex didn't feel good when I was younger.
Right.
That comes along with the conditioning. So once I started to realize that, oh my gosh, if I actually spoke to my needs and asked for the things I wanted, that would really help to open up and have a more embodied experience where I can actually notice sensation as it's occurring and not rushing through something.
Yeah. I think also our vocabulary to do with sensation is pretty limited.
Yes. Yeah.
I often get clients where I say, what does this feel like? They'll say things like, feels fine, but fine is not a sensation. Right. Or feels good or doesn't hurt. And I'm like, doesn't hurt is not a sensation. So what is the sensation? And they find it really difficult to pinpoint that. And so then we go through this whole thing of what does it feel like? What is something that feels bubbly? What is something that feels full? What is something that feels sharper? Exactly.
And also for clients who are that way, who have a hard time describing sensation, it's easiest to start with what's the temperature? How is the temperature on your skin? Oh, it feels cool on my elbow, but it's warmer on my ear, right? Yep. What does the surface you're sitting on feel like? Is that hard? Is it cushy? So you just start generally and start to help build that understanding of how to describe what is happening within, just using the senses to connect with and bring in that recognition of what's talking in your body. I mean, really, it is the body's way of communicating with us is by sensation.
And it's a really interesting exercise because the more sensations you manage to describe, the more sensations you feel.
Yeah.
It's sort of that labeling it allows you to notice more of it.
Mm-hmm.
When I was in school, I remember our teacher telling us that some people in the world only had 7 colors or 10 colors. And I remember thinking, how can they only have 10 colors? It's so clear. You look around and there's like loads. But it's because they grouped colors into certain things. So all greens were the same. There wasn't a light green and a dark green. They were all grouped. And so there was only 7 of them. And when you start learning things like magenta and puce and whatever, all different kinds of colors, then you see more colors because all of a sudden you're noticing different shades and different tonalities. And it's exactly the same thing with sensation. The more you notice it, the less you're grouping it under something like feels fine, right? Feels good.
Yeah.
People will say things like, it feels good. Okay, but what does good feel like to you?
Yeah.
What subset of sensations make up that feels good? Is it tingliness? Is it electric? Is it warm? Is it soft? What is good? I don't know what that sensation is.
And a good way of working with that too is doing the co-regulation exercises.
Tell me about this.
Co-regulating is allowing one person to be a leader and the other to mirror. And so you have a certain task to do within a small amount of time. One person gets a turn as the leader and the other person is the mirror or witness. And then you talk about what you noticed in your body. What was that like for you? And then you switch so that the witness gets to be the leader and then the leader gets to witness. And during these exercises, you are very aware of your body and what you're sensing and what's happening as you're exchanging with this other person. And so co-regulation is balancing each other's nervous system. I don't know if I would say balancing, but noticing your own nervous system and having it reflected back to you. So it's a self-awareness, but at the same time, you're engaging with someone else. So we heal together, right? It makes it a lot gentler to come into your own when you are reflected back. How you're feeling and what you're seeing the person reflect you do.
Yeah.
And this I find is a great way for people to become self-aware. Oh my God, I felt a lot of movement in my chest. There was a lot of heat rising from my chest, or I felt my jaw clenching, my teeth were grinding together. Or I felt a lot of spaciousness in my belly. That's a great way to help people settle in and notice themselves and tune into sensation.
Yeah. And again, it doesn't mean that you'll like every sensation.
Yeah.
And even numbness is a sensation.
Yes.
Again, it can feel muted, but it feels like something. It's very hard to feel nothing. Like I would challenge pretty much anyone that they feel something at any given time, not nothing. It's just sometimes very hard to put that into words, what it feels like.
I've had clients, I'll ask them, what are they noticing, in your body? And they will say, I don't know. And I said, okay, well, what does I don't know feel like?
Mm-hmm.
And they sit with the I don't know. And it's okay. You don't have to label it. It doesn't have to be anything, but just sit with the I don't know. And where is that in your body? Where's the I don't know?
Right.
So, maybe it's the belly. And if they stay with it, like, oh, now it feels bubbly. I don't know. It's bubbling up, it's starting to change in some kind of a way.
I would also challenge the I feel nothing, because I used to say that about my stomach all the time. I used to say, oh, I feel nothing on my stomach. And that is not true. It's interesting because I can feel heat on my stomach. So challenging that idea for myself, even taking a hot water bottle, putting it on my stomach and saying, yes, I do feel heat. And I also feel that there's some sort of a pressure. Like I feel the pressure of something lying on my stomach. Probably couldn't identify what it was with my eyes closed if someone just put it on me. But I do feel the heat. I do feel the pressure. If somebody punches me in the stomach, I can feel pain. So there is something. It just most of the time feels muted.
Or maybe even a density. Like that's, for me, it's a lot of density.
Yeah.
With scar tissue in particular. Because I think scar tissue definitely feels different than a psychological, like numbing out.
Right.
It's like an avoidance. I almost consider that, like the psychological, it's a part of you. It's like IFS.
Internal family systems, for people who don't know what IFS is.
So it's like this part of you that's numbed out. It doesn't want to be seen. And it's like a psychological disconnect. So I find that sometimes with men who have ED,
Mm-hmm.
they just kind of generalize, like you're saying, like, I don't know, I just don't feel anything.
Right.
But oftentimes it's the mental chatter that's happening up in there and a resistance to actually really connect because it's this subconscious void that they don't want to go into their genitals.
Into their feelings. I
The
think men have
feelings.
less problems going into their genitals than they have going into the emotions and feelings around
The
their
high
genitals and maybe
charged
the
feelings.
shame that comes up with that, or the pressure.
100%.
I have clients who have erectile dysfunction just because of how much pressure they feel to have to perform for their mate to have a good time. And when I ask them, but what does it feel like to you? They almost look confused, as if, I don't know, it's not supposed to feel like anything for me, but I want my partner to be satisfied.
Yeah. Yeah.
And that's always really interesting to me because both people are supposed to feel.
Yeah.
It's not for one person or the other. You're supposed to be able to both feel. Even if you are engaging in oral sex or something where it does feel like you are giving, right? Which is
Yeah.
not necessarily true because some people really enjoy giving oral sex and it can be as much for them as it can be about the other person. But
Right.
even then, it would feel mighty strange if it felt numb, if you couldn't feel it, taste it, smell it, have some sensation there. You need sensation. Sensation also tells you if you're on the right track. Sensation tells you if you are doing something that's good for your body, if you need to move position, right? If you're giving head and you've got like a horrible neck cramp, you need to change position and go, it's not like, just muscle through or not feeling it. Like that's not,
Right.
that's not going to be good for anyone because the other
Mm.
person will feel it too. They'll also feel that you're not comfortable.
Yeah. And then it's not good for either of you.
Right. And so
You're pushing.
it's about knowing what sensations are so that when some sensations come up that you're like, oh, that is a discomfort. And it's a discomfort that I don't want to, nor do I have to sit with. I will change it. You can change it and change position. You can adjust. You can do lots of things.
You can. Sometimes people don't. And they suffer through it, right?
Right.
Yeah.
Because you get a medal for that, right?
Yeah.
A sex fairy comes and gives you a medal.
Right. Pat on the
Pulling your
back.
neck.
Yes.
For heroic service.
The strongest neck. You can hold it as long as you need to.
It's funny that people have these ideas of, I should just be uncomfortable and you'll be fine.
Yeah.
I can always feel it if someone's uncomfortable.
Oh, it transfers for sure.
Yeah.
Uncertainty and the holding back or the discomfort or the agitation. Like, of course, your body's going to feel that,
We have mirror neurons. We can feel to a certain extent what other people are feeling. That's how we have empathy and things like that. We can see pain in other people's eyes and then feel pain. We can also get infected with all kinds of emotions and sensations just by attuning to another person. And so it's really interesting that we just think if we are in discomfort, the other person will feel great. Like, of course not.
Yeah. There's compassion and they feel it. And so why do they want you to suffer if you're someone that care about them? You're going to want both of you to feel good. And all of that goes into like, who's doing what and why, who's it for? Yeah.
Is it for?
Because that gets really intricate and very confusing if you're not aware of why am I doing this action?
Did someone ask for it? Did you decide that that's what they wanted? Is it what you want, but you would rather pretend that it's what they want? There's a whole lot of sneakiness that comes into those things. Not necessarily even that the person knows that they're being sneaky. Sometimes it's very unconscious.
It definitely is. And that's an avoidance of being vulnerable too, right? So you're going the indirect route of trying to get your needs met by pleasing others.
I definitely have clients who have come in with numbness. It's interesting because I will try lots of different things. And I know that for my own numbness, I'll speak for myself, what's really worked on mine is bringing that sensation from other areas of my body down and up from areas that have sensation and meeting them in the middle. It's also been interesting. I have a client who used to touch her scar in front of the mirror, because even though she couldn't necessarily feel herself touching the area, or she could feel it, but very muted, when she saw herself doing it, she had more sensation because her brain understood, oh, yes, you are touching that area. And so she started to connect it more that way by touching that area while looking in the mirror. She was making a connection where the brain could see that she was touching the area. Yeah. I also really like the claws, the BDSM claws.
Okay, tell me more.
So they're these Wolverine claws. You can get them on any good kink site or on Etsy even. And they look and are actually incredibly sharp. And
Yes.
you stick them over your fingers, and it just looks like you have
Individually?
yeah,
Your fingers, yeah.
individual metal claws, and they look nasty. They really look like something you would not want raked down your body.
Like a werewolf slash. Yeah.
And I'm sure that if you had them on in a fight, wow, that would be horrible, and people would bleed, and you'd get arrested. But don't use them in a fight. But if I use them on myself, first of all, also feels great. So sometimes I'll put them on and just work on that numb area, because they actually feel sensation with it. And also it leaves track marks, which I can see. So it also lets me say, this area was touched. I have seen it. I can feel it. There's a sharpness to the claws that I can also feel. They're also quite sexy. So I think that adds to the whole, okay, I'm doing something exciting for myself. And that is a mental stimulation that also kickstarts the neurological sensation, I think. I love that.
The fiery touch.
Oh my gosh. I could have a sex bot session of me just lying on the table for an hour, having someone do those nails, and they don't even have to touch my genitals. They can avoid my genitals altogether and just give me scratches all down my neck and across my scalp and my chest and my back, anywhere, really. It just feels so exciting and dangerous.
Yeah.
Exciting and dangerous.
You know what's curious is you and I are different makeup as far as like elastin and collagen goes, right? So you're more collagenous, meaning more thick muscle, strong, and you gear towards fight. So I'm more elastiny and I gear towards flight. And so yeah, I'm curious about that, you know, the fiery touch, the dragging and the sensation of the excitement of a little bit of pain. I don't know how much you like the stinging or whatever it is. And compared to a different nervous system who might be, I'm more like a soft touch person, like that will send me off. How does soft touch affect you with?
I like it sometimes and some places. So I like soft touch on my back. I find it more comforting than arousing. There's also an association there, because my grandma used to do soft touch on my back all the time as a kid.
Yeah.
And so if I'm feeling sad, or if I feel like I want comfort, having soft touch on my back makes me sort of curl up into a little ball and go into a bit of a childlike, being taken care of state. It doesn't make me be like, I want to have sex.
Yeah. I can feel that in my body. Like I'm feeling a warmness all over my low ribs and my belly softening. Because it's like, you know, you're associated with grandma would do this, and it's very safe, right?
Yeah.
And also to the point of coming to an edge of more sensation, let's say with the Wolverine claws, it takes you outside of your complacency too, right? And it really starts to fire everything, so that perhaps someone who's more in the realm of the norm and doesn't like to go to the edge of the resilient edge of resistance, right? This would be a great way to pop out and move to that edge and feel more of that sensation. And it actually will change your capacity for sympathetic arousal, which will drive more blood into the body, more oxygen, and create more of the flow of sensation.
Playing with the safety and risk that is also, for me, for my body type, for my Eros type, works really well, because I love a bit of risk. I'm Sagittarius. I just like a bit of risk is great for me. And some people are risk averse and they don't like it at all. I wouldn't give those Wolverine claws to just anyone.
Yeah.
So it's that knowing that my nervous system can calm, but also I'm upregulating it at the same time.
Yeah.
That's what gives me the erotic charge. And that's where numbness sort of dispels, because
Yeah.
it's taken care of by the safety, but you're also piercing through that numbness. You can't avoid the sensation of claws. Claws feel, and that's what's so very titillating about it.
And then it's not a labeling because it can be painful, but it's pleasurable at the same time too. So we learn to associate different sensations, even though we think it's painful in air quotes, there's actually pleasure with it too, right? So it's how we're labeling things, and we can get rid of that judgment and that connection.
Yeah.
That brings us more into just what is in the present moment. Really, when we think about scarring too, if we're looking at it as like a high charge point in the tissues that is holding a lot of the emotional capacity, that stored energy absolutely needs to be released if that's what it's asking for, if that's the point in the session where we've worked with a client a lot, we've done a lot of work together. If there is release to be had, that would be had there. But also being able to come back into the expansion
that's sharp enough that you will feel it, but you can't not feel claws. But at the same time, it's still safe. So you're not doing anything that would harm you.
Yeah.
But it can feel like something might harm you, which is the risky part of it. The other thing that I use other than the claws is also electrostim. There's devices that you can get for your back if you have backache, and they send a little electrical charge. I think TENS machines, those kind of thing. But you can get actual electrostim devices. They have these little sticky things on them, and you can put them in an area, sort of like when you watch the shopping channel, and it shows you how you can get abs while sitting on the couch, and it shows you this device that you put on your stomach, and it electrocutes your stomach,
contracts the
muscle contraction, and you never get abs from it, but it feels weird. So I use electrostim on my numb area. That also feels really cool, because I can feel my muscles contracting, even though I know I'm not contracting them. And even though I'm not feeling anything on the surface level, I'm feeling it deep underneath, because those muscles are contracting. I remember the first time I had a session like that for myself, and I could not stop laughing. It just felt hilarious that this area that I felt like I couldn't feel had a mind of its own. It was doing stuff, and I could feel it. I just couldn't feel it in a way that I was used to feeling it.
That's a great idea, because it is sending those electrical pulses out.
Yeah.
So that creates an awareness of sensation. It would be an amazing feeling to notice that. That's kind of like looking in the mirror a little bit, right? So seeing and watching what's happening to your belly with this stimulation, and associating that, these are connected. That's my body. This is touch. This is the muscle moving. It's for a lot more connection.
And slowing down. And that's something that I'll tell my clients with numbness all the time. Slow down, you will feel more. And breathe. Slow down and breathe, and you will feel more. The more you breathe, the more you feel.
Yeah.
The more you feel, the more you should breathe.
Well, and also to expand your capacity of awareness for the sensation. Even if in sex, while we are getting aroused and we start to gravitate towards peaking, climaxing, breathe more and expand that sensation throughout the body. Allow yourself to feel it all. It doesn't have to stay in just one area.
Right.
You don't have to keep rushing. You don't have to get anywhere, which is a lot of the point of sexological body work, is just being with what is right now. Breathe, go slow. What is present? Let's just stay with that presence right there.
And I think, again, when people talk about intercourse and a lack of sensation or a numbness, I'll have clients who say, penetration, I can take it or leave it. It doesn't feel bad. It doesn't feel great. It just feels right? Which I also take as a sort of a numbness. It doesn't feel like nothing. It just doesn't feel like a sensation that you would want to describe. And for those people as well, I would say, slow down,
Mhm.
and maybe use something other than a penis. Maybe use a finger.
Yeah.
Maybe use a wand. Maybe use it in a different way than you've been using it. Maybe heat it up. Maybe
Yeah.
use something that
Oh.
feels tingly, and notice how the sensation changes. Notice if there's sensation if you just hold something there.
Yeah. Stillness is nice.
Yeah.
Really very responsive. I find my vulva on the outer side, the vulva is so responsive to just holding a finger, two fingers there
Yeah.
and letting it, talk back to that pressure.
Yeah.
Staying with that. And that is stillness and that is slowness. And the other thing that was coming to my mind when you said about not liking penetration is, well, are you asking for what you want? And
Right.
are you enduring? Are you enduring what's happening? You feel like you don't have choice. That's a numbing out too.
I think a lot of people just think that that's what sex is.
Definitely.
If you're not having penetration, you're not having sex. That's a lot of people have that as a cultural, well, of course.
That's the standard way of that is what sex is
Yeah.
penetration. And
So it's like ticking the box. Yeah, literally, physically. It's
did
like
it.
sort of saying, well, it's not sex without this, so I'll just do this and then it'll be over in however many minutes, and then I can either go to sleep, or maybe I've already had my orgasm, or maybe I'll have my orgasm afterwards once he's finished.
Yeah.
It's interesting to me because they always do these studies where they show the level of sexual satisfaction in women. And it's that lesbian couples have like a rate of sexual satisfaction that's like 97% or something astounding. Whereas
No
women with
Really?
and there's the rate plummets basically. And then the rate for masturbation is also very high. But it's because you're not asking for what you want. And again, when a woman is with a male partner, we center the penis a lot. And it's not
Yeah.
necessarily about what it might feel like for the woman's vulva. It's more, well, a man needs to come. So I guess that's my job is
Go
just
on
to
with
lie
it.
here and make sure he does.
I'm the receiver.
Right?
Just do it. Yeah.
And there's no active receiving in that. And of course, there's going to be a numbness that's going to sneak in
Yeah.
if that's the narrative. The narrative is just, I've just got to lie here and wait for it to be done. It's
I
not
don't
my
have a
favorite part.
choice. I can't stop it. That reminds me of a story one time that I experienced. I was so used to just enduring in sex. And I was with this partner and we'd been dating for a couple months, maybe a month or so. And we went back to my house and I had wanted to just hang out. I wasn't really feeling it. I wasn't inviting him back so we could have sex or anything, but it was really let's just hang out. I just want to hang out with you. So I decided like, let's just put on some music. Let me move my body. Because I was kind of like just stuck in my mind and wasn't feeling very open. So I was like, let's move our bodies. So we're kind of dancing together and his hand starts to come up on my leg and he realizes I'm not wearing underwear. And then he just started to get really into it. And I'm thinking, well, I should probably be into this too. Like, this is hot or whatever. And so we end up on the couch and I'm just wanting to kind of like feel the body, feel the warmth and be really cozy in that. Well, he charges in and puts himself inside of me. And I remember thinking, it's fine. We've been together for a while. But it was very clear to me that I didn't want this. So this little voice spoke up and was like, it's okay to stop this.
Yeah.
And so I just put my hands up. I said, I'm done. I'm done. I'm done. And he got off of me. And I was like, I didn't want that. I didn't ask for that. And
Good job.
it was really hard to do that. And as ridiculous as it sounds, I was a grown woman and speaking up for my needs or not accepting something that I didn't actually want, but going along with the norm of, well, this is what sex is. And the script also that you kind of asked for it type of a thing.
Right.
Right.
You were dancing and you
And
weren't
you
wearing
didn't have
underwear,
underwear
so
on.
clearly.
So yeah. But speaking up for myself and saying like, I'm done. And it's okay to stop something in the middle because that's when, and also let's say if we are receiving penetration and we're not fully aroused, well, what happens? Adhesions and adhesions create scars, right?
Yep.
So then you get that numbness that within your vagina, you have that numbness from accepting penetration. So there's your own boundary violation. And then there's the physical of the scarring within your vagina.
Yep.
So there's that emotional and the physical part of it, the biomechanical part of it is the scars forming.
Yep.
And your emotional override of not speaking up for your needs. And that comes into that genital hole and that avoidance. It can, not always.
Yeah. And it's funny because people don't understand that that's the same thing as, for example, if you're a kid who doesn't like Brussels sprouts and your parents force you to eat Brussels sprouts,
Yeah.
and you grew up with an aversion to that vegetable, or whenever you eat it, you're just like, yeah, right? Because you didn't want it, and yet you had to have it, right?
You finish all your food. Yeah.
Or else, yeah.
Or you'll eat it in the morning for
It
breakfast.
comes with a threat, it comes with a cajoling, but if you don't, you won't grow, and like all these lies and all the things that you're like, that does not sound true. And even as an adult, you're kind of like, I don't like that. Right to this day, I won't eat meatloaf because meatloaf was a thing in our house that if we didn't eat it, we'd go to bed with no dinner and no dessert and whatever else. I loathe meatloaf. And I'm sure, I constantly have friends saying like, oh, I'll bring a meatloaf to this. And I'm like, no. And they're like, no, but I make a really good one. And I'm like, no,
not at all.
I don't care how good your meatloaf is. You're not bringing it. And it's the same thing with penetration. If you have had unwanted or unpleasant penetration for a long time that you could not, or you felt you couldn't say no to, then you're not going to want penetration, even if someone's like, no, but I'm really good at it.
Right.
So you get rid of that partner who was always pushing unwanted penetration on you. Even when you have a partner who's loving and who's kind and who's sensitive and who's caring, you might still have numbness and shut down. Because it's going to remember, just like it remembers the Brussels sprouts, just like it remembers the meatloaf, it's going to be like, nope.
Yeah. And that goes with your nervous system, right? So it's coupled with meatloaf is bad. That's a fight response.
Yep.
Ice cream is good. That is a pleasurable response. That's rest and digest. That's parasympathetic. So now it's story and state. You're coupling these experiences together.
Right. And the way that you get to eat the meatloaf is you deconstruct it. So if someone says, I brought you this meatloaf, I'll be like, absolutely not. But if someone says, here, try this little tiny bite of something I just put on a fork, and they don't tell me that it's meatloaf, and they say, it's my special recipe, and I look at it and I taste it, and I might say, oh, that's delicious. What is it? And then they say meatloaf. I might be like, oh, okay. But I tasted it, and it wasn't that bad, because it was like a small piece. It was from a person that I trusted, person who wasn't trying to shove like a whole slice of something on a plate for me.
And I think that's super important that you say, because you're speaking about titration and taking things in small doses. So in our work, it is somatic, which means that it affects the whole body. And it's not a conscious thing of, I'm going to do this thing, and then I'm going to get this result. It's a slow shift and change within the body that you don't have to consciously do. But because you're working with the body in these slow titrated ways, then you start to see changes and shifts in your everyday life. And I think that really is the beauty of sexological body work, stream work, is that the body will start to do what it is you are desiring when you work with it.
Yeah.
And you do it in little doses, and you're not going fast. You're not trying to take on everything and do A to Z in 2 sessions. You can't. I mean, that's, you got to remember, like, this is our lifetime, one person's lifetime, that have built up these resistances, these beliefs, these habits, and it cannot be undone in a couple sessions. It is slow work, and that is lasting work.
All those grooves that have been carved over many, many years. It's like rerouting a river. That river was formed because drops of water kept falling on the same spots, and then it created a groove, and then water went through that groove even more, and then it created a whole flow. And in order to reroute that, it takes time. You can't just take a pencil and draw another line in the sand and expect the whole river to reroute. It takes time. And that's mindful touch. That's conscious self-pleasure. When we talk to people about mindful erotic practice, that's what we're talking about. We're talking about taking that small bite, the tiny bite of the meatloaf, maybe not necessarily knowing that it's meatloaf, because maybe that's the story that we tell ourselves.
Absolutely.
Something is horrible. But if we take the name away from it, we call it something else. Maybe we don't like the word masturbation. Maybe that's maybe that has bad connotations. So call it mindful erotic practice or call it conscious self-pleasure.
Mm-hmm.
Maybe that takes some of the weirdness out of it.
That stigma of masturbation. Masturbation just feels so like sinful. I think I was raised very religious, not super religious, but as a young child, we went to Sunday school like every Sunday, and masturbation was like, oh my God, that is such a bad word. And so my belief with it is like, oh, I like the word self-pleasuring.
Pleasure is not always taboo. You can have pleasure that isn't always off limits. But masturbation as a kid was always off limits, felt like, at least society was off limits. And so maybe as an adult, you don't want to use that word because maybe that's going to bring up that numbness and that rejection. And if you call it something else, if your narrative is something else, and you just do it in really small doses, you set a timer for 5 minutes of self-touch. And maybe it's not genital touch. Maybe you touch everywhere on your body except your genitals, unless it feels like they're calling to you. And then for people who can't do that by themselves, it's seeking out people like us, trauma-informed body workers, sexological body workers, or stream practitioners, which is also what we are. We can help with that. If you don't know where to start with numbness, if you've tried and you don't feel like you're succeeding, having people like us can really help you push through that, because we're willing to try all kinds of different things. I'll get my claws out, you know, like the electrostim.
Yeah. Each individual person, where are they at? Where can we start? I tend to get a lot of people who have a lot of boundary ruptures and don't know how to express needs. I mean, clearly this is something that was big in my life, and that's why I tend to focus on it, because it was a struggle for me. So I tend to attract a lot of those clients. So it might even be something slowing down and finding sensation talk, you know, and you're attracting different clients because you're at a different place.
I think it's really important when choosing a practitioner, for clients who are listening and who are wondering, how do I find a practitioner who can help me do this work? It's really important to find one that's trauma-informed and who is good at things like mindful touch and breath work. So if you're not sure about those things, ask your practitioner ahead of time. And I would love if we could hear some experiences from our listeners. If you've experienced your own experiences with numbness, if you have your own stories that you want to share with us about numbness, either via social media or email, we'd be really happy to talk about them in the next episode if you want to. Of course, they can be anonymous, and we would love to connect more with our listeners about this.
I think that what we discussed in our conversation, my favorite aspect of it really is the slowness and the tidbits. That is very juicy and rich for me in that. I'd love to hear other people's stories and their experiences with how they connect with these numb parts, or even if they're aware of it, and maybe now they have more ability to tune into the parts of themselves that are ready to kind of be felt and seen a little bit more in that numbness.
Yeah, that journey from numbness to sensation is personal, it's unique, and also it's important to say it's never too late to start reconnecting with your body or to start dispelling numbness. Once something is numb, it doesn't mean it's numb forever. Something good to remember. As our teacher, Ellen Heed, says, nothing is beyond repair.
Absolutely.
Yeah. We have a workbook that goes along with this podcast. If you would like it, just message. We will also probably have a link up when it's on some kind of a platform that allows us to do that. But if you would like the workbook, make sure that you message us and we will send it to you. And meanwhile, thank you so much for listening to our first episode, and we hope you enjoyed it. We're always open to your feedback and to hearing more. So thank you. And thank you, Angie, for joining.
This has been awesome.
You know that pull, that spark inside. Your body speaks, don't let it hide. It's time to listen, time to feel, time to tap into the nerve to heal. Let's break the silence, break the shame, reclaim your body, call your name, the nerve to heal. Let's go deep, unlock the wisdom. dark inside. Your body speaks, don't let it hide. It's time to listen, time to feel, time to tap into the nerve to heal. Let's break the silence, break the shame, reclaim your body, call your name, the nerve to heal. Let's go deep, unlock the wisdom your body keeps. Let's break the silence, break the shame, reclaim your body, call your name, the nerve to heal. Let's go deep, unlock the wisdom your body keeps.